Your heart's a very important muscle in your body. It's constantly working. However, if you have atrial fibrillation, also known as A-fib, your heart's not working as efficiently as it should. A-fib is the most common type of irregular heartbeat, characterized when the heart's upper chambers, the atria, beat out of coordination with the lower chambers, the ventricles. This condition may appear with no symptoms, but when the symptoms do appear, they include palpitations, shortness of breath, and fatigue. At least 2.7 million Americans are living with A-fib. September is Atrial Fibrillation Awareness Month, so we sat down with Dr. Nitza Alvarez, a cardiologist with Tri-County Heart Institute, and one of her patients to learn more about the condition.
Atrial fibrillation is an unorganized heart rhythm. It's rarely a life-threatening condition. The major issue with atrial fibrillation is the risk for stroke. When your heart is beating unorganized, it makes clots form in the atrium, the upper chamber of the heart. At any point, that clot can get out of your heart and it will go to anywhere in your body. If it goes to your brain, it will give you a stroke. In this case, anticoagulations are recommended to reduce your risk for stroke. Your doctor will know if you're at high risk for stroke and then will be recommending the appropriate anticoagulation therapy for you. We always try to use medical therapy first. When patients are very symptomatic, or if this is the first time that you're diagnosed with atrial fibrillation, your doctor will probably recommend electrical cardioversion. A cardioversion is a procedure that is done to basically jumpstart your heart. It resynchronizes your heart and bring your heart back in rhythm. This procedure is effective in many patients, especially those patients that suffer from symptoms related to AFib, like shortness of breath, dizziness, lightheadedness. I have a patient, Thomas Stockley, that had been suffering from shortness of breath for actually many years. And it wasn't until he received his cardioversion and his heart rhythm was restored that he was able to realize that the shortness of breath was actually linked to this arrhythmia.
I couldn't walk around the corner. I couldn't walk my dog, I couldn't do nothing. I couldn't catch my breath. That's the worst one. It really took a lot of strength out of me, and it just progressively got worse. It affected everything, my legs, I got so tired. I thought it was something major with my heart, and that's when I came to see Dr. Alvarez. She put my heart in the right beat. It was a life sentence. I've been in A-fib for about 12 years. The second time I seen her, she fixed me right up. It worked, It really feels good. Life is good. Can walk the dog, I can walk around, do anything I want. It's so much better. Dr. Alvarez you can't beat her. She's the best.
Join Dr. Alvarez every second Saturday of the month for Walk with the Doc. Participants will enjoy a brief presentation on an important health topic, followed by a walk at your own pace led by Dr. Alvarez. You'll find information on Walk with the Doc and the Tri-County Heart Institute when you click the Every Beat of My Heart story link icon online at yourhometownhealth.com.